Okay, hello everyone. We are the RHAT Pack, so we're the Refugee Health Access Tool. I'm Yasmin, this is Mackenzie, Carol, and Salwa. Okay, so I'm going to start by asking you two questions, and please raise your hand if you answer yes. How many of you have smartphones? Everyone, great. How many of you use smartphones to gain information? Again, everyone. Okay, good. So I want you to keep that in mind. Think about how often do you use your phone? Every day? Every hour? Do you fall asleep with your phone in your hand? I'm guilty of that. How about how many times do you use your phone to make decisions about what to do? So, yes, probably. Yeah. Where to go this weekend? Where to hang out? Okay. So, this tells us smartphone use is not something unique to us. It's also prevalent to the refugee population. So the UN report did this fantastic study on technology and refugees, and it showed that 68% of refugee households have smartphone. And that's only 7% difference than the national average, which is 77%. 9%, sorry about that. So, everyone raise their hands, so it's clear that smartphone is an important part of your life. It is also the same thing for refugees, but it can also be a lifeline for them. According to the literature, when it comes to healthcare, there are many barriers that refugees face to access healthcare facilities. This can be things related to information, transportation, finances and money, can I afford it, cultural sensitivity and interpretation, so we know that access is an issue in all its forms.
So knowing that technology is really important part of our daily life, and our goal is to how we can harness this technology to create an information sharing network to assist refugees in accessing cultural and competence healthcare facilities. And we're planning to do through the creation of the Refugees Health Access Tool, which is the RHAT. And the philosophy through our objective and our all activities is to refugees collaboration occurs across the entire innovation process.
So let me walk you through our objectives. Starting off with objective 1, we want to collect information about what already exists in terms of cultural competency and cultural sensitivity as it relates to our local healthcare facilities. Objective number 2, we're looking at analyzing data from 2 different avenues. Those avenues are data from facilities as well as data from community input. We want to merge the 2. Objective number 3, we want to share with our larger community what was found using our tool and app. Objective number 4, we believe there is power in numbers. We want to monopolize on that power. We want to use crowdsourcing to give us real-time data. And last, objective 5, we want to develop action plans to give back to the facilities in order to be a catalyst for healthcare change. So, the top of this slide has to do with our process and our timeline. It's a roadmap of where we are headed. As a complement to the very top half of that slide, we also have where our objectives fit in, 1 through 5. As part of our presentation today, we wanted to focus in specifically on objective 4 and objective 5.
Just as a review for objectives 4 is to obtain community contribution of real-time data through crowdsourcing. So who are unclear of what is crowdsourcing, it's utilizing the community and their information as mean for coming up with ideas and feedback and can be improved. So showing in this slide, which is our visualization of the app that come from the objective 1 through 3, whereas we have like the name of the name of the health center and how many people see or reviewed our this center. Then in the lower part, whereas we have the services available in red, and we have the unavailable services in gray. So, and the mostly important one is the participate button, whereas a crowdsourcing come from.
Okay, so objective 4 has several different activities. To start it off, activity 1 is to create a feedback system, which will create the guidelines for what and how our users would be able to provide the feedback. Activity 2 is to create the crowdsourcing tool itself. With this plan, we plan to enlist the help of refugees to help develop the tool and develop the code, and that allows for constant feedback through the application. Activity 3 is to implement a training program. We plan to hire refugees for this as well. As leaders, that will help us develop a program that will be most effective for the population. We will then recruit volunteers to promote the program in community organizations, where we will then conduct training on how to use the app. The last activity is to promote the use of the app itself. So we'll recruit volunteers to raise awareness and distribute flyers to healthcare facilities and community centers, and also implement like a payment reward system based on the participation of the users.
So also as a review for objective 5, which is developing an action plan for healthcare facility now to enhance their cultural competence service and physical accessibility.
Okay, so activities for objective 5. We're going to start with activity 1, which is to create a report based on the crowdsourcing data that we can provide to the healthcare facilities. For activity 2, we'll create a task force of experts from the community. And activity 3, we will use this task force to then create a set of guidelines based on the design, management, operation, and services of the facilities. And for our last activity, we'll create an action plan using the data collected for the healthcare facilities to show them how they can improve their services.
So for the actors that we are seeking to contribute, as you can see in this graph, and there is like the size of the each bubble is the amount of the contribution that we are seeking or looking for within our process.
So next, we wanted to look at what is out there. Is someone else trying to do something like our idea? So we found a creator, one of the mentors suggested looking at the Waze app. So the Waze app records conditions of the streets using crowdsourcing. What's interesting here is the Waze app has collaborated with DOTs across the country, and this is also globally, in order to create this kind of network of information sharing to improve the level of service of streets. So we know this has been done and successful in other community services. So can we do it also to healthcare facilities? So when it comes to refugees in Berlin, a group of refugees created a map of resources for newly arriving refugees. So this includes things like where the free public Wi-Fi is, where healthcare facilities are, and where education services. Unfortunately, it's only available in 2 languages, Farsi and Arabic, and it only provides minimal information. In the US, Paro Mobile Company has created an initiative to work to connect refugees with technology and design apps that might be helpful for them, like things related to finances and employment. This is in its pilot stage, so unfortunately there isn't much information out there, but once there is, it will be great for us to learn from. There's also a refugee aid app similar to the map in Berlin that provides sources, but it's not available in the US. So all of these sources in the previous slides tells us that this is happening. People have recognized the importance of technology, so how can we collaborate with them and learn from them?
So let's look at our primary and secondary benefits. What are our immediate and our long-term vision? For the primary benefits, it's all about providing new access to reliable health information, gathering consistent feedback, and also an opportunity to give our refugees a voice. They are the voice of the consumer, but they also are a voice that's important in terms of gaining a sense of independence for themselves. For our secondary benefits, we think our tool could help with accountability, in the sense that under the current system, state and federal, there's a lack of accountability for agencies that are serving refugees to provide culturally sensitive and culturally competent services. This model is scalable and can be expanded to other languages, other populations, other community services, and it can also enhance the digital literacy of our refugee population.
Okay, real quick, can I finish? Okay, yeah. This is a model that was published by the UN to address the three main challenges that are faced when trying to use technology to help with the refugee crisis. We anticipate that we'll be presented with similar, if not the same, obstacles, but it's good to acknowledge that we are not unique in dealing with these problems, and they're a focus on a global scale.
So we are the RHAT that.
Any questions?